Hi, my name is Emily Kinsella, and I am the section manager for the Women's Wellness Connection program. Today I will be introducing you to the WWC program and will walk you through how to use these informational videos. Welcome to the Women's Wellness Connection, or WWC, a nationally recognized program responsible for assisting thousands of low-income Colorado women to complete breast and cervical cancer screenings. The mission of the WWC is to provide, promote, and ensure quality breast and cervical cancer screening for underserved women in Colorado and connect them to resources. Our WWC team will present a series of videos to help you navigate the WWC policies, processes, and practices necessary to make your program a success and give you the information needed to run a successful WWC clinical services or care coordination program. Each video is organized into sections that generally follow the flow of a client, starting with outreach and recruitment and ending with reimbursement and subcontracting. They also follow the structure of the WWC Provider Toolkit located on the WWC webpage. There's a screenshot of the webpage here and you can see where the link is. If you do not find the information you need in these videos or the toolkit, please do not hesitate to contact a member of the WWC team. Now for a historical background of the program. In this part of the presentation, I will go over WWC's funding, a program overview, and WWC's broadening focus. WWC is funded through the Centers for Disease Control and Prevention, or CDC's, National Breast and Cervical Cancer Early Detection Program, also known as NBCC-EDP. WWC is also funded by Amendment 35 tobacco tax state funds, which are outlined in Colorado Revised Statutes 25-4-1501 through 1506. Within WWC, there are two main programs, Clinical Services and the Care Coordination Grant Program, or CCGP. The purpose of WWC Clinical Services is to provide breast and cervical cancer screenings, including clinical breast exams, mammograms, pelvic exams, and Pap tests to eligible women statewide through contractual agreements with agencies that include federally qualified health centers, local health departments, rural hospitals, safety net clinics, private physicians, and nonprofit organizations. WWC Clinical Services funding to agencies also provides a broader system of services through patient navigation of normal screenings and case management of abnormal screening results. Part of this broader system includes enrollment in the Breast and Cervical Cancer Prevention and Treatment Program through Medicaid, also known as BCCP Medicaid, if a woman is diagnosed with breast or cervical cancer. The purpose of the WWC Care Coordination Grant Program, or CCGP, is to increase care coordination services that will help to ensure access to breast and cervical cancer screening among clients who have or are eligible for health insurance, including Medicaid, and who meet WWC's age, income, and lawful presence eligibility criteria. WWC Clinical Services and Care Coordination are core components of WWC's broadening focus in order to reach the overall goal of reducing breast and cervical cancer morbidity and mortality. Paying for clinical services for those who cannot afford it will always be and has always been a core component of WWC. However, with the implementation of the Affordable Care Act, or ACA, there are less women needing WWC to pay for their services, as they are now covered by insurance, including Medicaid or private insurance. Thus, the expansion to care coordination, where we are helping these low-income, newly insured women to navigate through the system in order to complete their breast and cervical cancer screenings. We are also implementing systems changes and evidence-based interventions with clinics and systems like insurers in order to ensure that every woman who's insured or goes to a clinic gets the screening she needs, regardless of her income, payer source, or anything else. Other areas where WWC is focusing include systems changes and evidence-based interventions to increase cancer screenings among underserved women, as well as awareness and education for the entire population. Here is a list of resources with more information on the things I've talked about.